HIV/AIDS, the LGBTQ plus community, and health. What is HIV/AIDS? Human immunodeficiency virus, or HIV, is a virus that attacks the body's immune system. Acquired immunodeficiency syndrome, or AIDS, occurs at the most advanced stage of infection. The LGBTQ plus community and HIV/AIDS. According to HIV Info, in the United States, gay and bisexual men are the population group most affected by HIV. 67% of US cases are diagnosed in gay and bisexual men. Social discrimination and stigma is prevalent in many communities. This can occur both as a result of the individual being a member of the LGBTQ plus community or as a result of being diagnosed with HIV. Fear of judgment can delay testing and treatment. As a result of a HIV diagnosis or the individual being a part of the LGBTQ plus community, the stigma and discrimination can lead an individual not to want to seek treatment or get tested for HIV. This can result in delays in diagnosis, delays in treatment, and it leads to poor health outcomes. How can we reduce stigma through education? Public health campaigns can improve awareness, reduce stigma, and improve the uptake of preventative measures. These can be implemented as social media campaigns, TV campaigns, or within schools, communities, workplaces, and healthcare facilities. Specialized training for healthcare professionals in leading HIV/AIDS discussions and promoting prevention. A healthcare practitioner cannot effectively manage and prevent and improve the prevention of HIV/AIDS without having specific education as to how to start these conversations and how to have them in a safe, respectful, and inclusive manner. This kind of education could improve the healthcare professional's knowledge on how to deal with these highly nuanced situations and hopefully increase the likelihood that members of the LGBTQ plus community, as well as those who think they may have a HIV infection, to seek treatment or to seek testing. Community prevention initiatives such as the provision of free condoms in pharmacies could also improve prevention of HIV, as more people would have access to these preventative measures such as condoms without having to incite a financial burden upon themselves. What can I do as a future healthcare practitioner and a current healthcare practitioner in order to improve health outcomes in terms of HIV/AIDS? I can provide respectful, non-judgmental care. When I have a patient with me, ensuring that they feel safe and comfortable in discussing something that is highly personal and something that they likely have faced discrimination for before is of utmost importance. I can advocate for inclusive healthcare policies. As a healthcare practitioner, I can meet with local government, I can meet at conferences with my peers, and hopefully advocate for inclusive healthcare policies that empower individuals to seek the type of preventative measures and treatment that they need. And lastly, I can promote health education and awareness. Again, this can occur in a variety of places, such as in a healthcare facility, in a school, or in a workplace. And this can take the form of many different avenues, such as newsletters, emails, social media campaigns, and this can simply raise awareness for HIV/AIDS and for the resources that are out there for individuals with HIV/AIDS or those who suspect they may have it. HIV/AIDS is a condition which is hugely impacted by stigma, particularly in marginalized communities such as the LGBTQ plus community. Persistent social and economic factors, including stigma and discrimination, continue to cause health disparities, compromising the health and well-being of people from marginalized communities. We can improve health outcomes in HIV/AIDS by focusing on prevention, health education, and advocacy. We can utilize the resources that we mentioned before, such as health education, the provision of additional services such as free condoms in pharmacies, as well as advocacy and the spreading of awareness through healthcare providers in order to reduce the inequalities that members of the LGBTQ plus community face and hopefully improve their health outcomes in terms of HIV/AIDS.